Due to the graphic nature of this program, viewer discretion is advised.
Numerous studies have shown that complex early childhood trauma is associated with the onset of many neuropsychiatric disorders. If the majority of people have experienced trauma in their life, why is there so much stigma around mental illness? The success of psychotherapy for treatment of mental illness depends upon reframing perceptions and experience in that individual's mind. What if, as a society, we need to reframe the way we look at mental illness?
I'm a clinical psychologist. I've been here at Santa Clara full-time for 28 years, teach as an adjunct professor in psychiatry at Stanford for 34 years, and have had a private practice in Menlo Park since the late 1980s. So I've done a lot of work with kids and families, and a lot of this has had to do with trauma. And the trauma is often, physical abuse, sexual abuse, being neglected. There's a confluence of factors that come together, that create these situations. So, some of them are just, terribly challenged home environments. There's physical abuse, there's sexual abuse, there's emotional abuse, there's chaos in the home, there's unemployment, there's marital dysfunction. In some respects, you've got multiple kinds of traumas and stressors coming their way, and lots of times there's not a whole lot of resources to deal with them.
Thinking through why some people can come out of trauma resilient and high functioning, and other people can go through that very same trauma and not be as resilient and have much poorer outcomes and be lower functioning. In your experience, what kind of factors differentiate that resilience?
Now, the research would say that not only the nature of these events, but how we interpret these events and the narrative that we use for these events. What's the story that we create on these things?
How might the symptoms that are coming out in a behavioral capacity be a coping mechanism?
They could be a productive coping mechanism. So, for example, like a certain degree of vigilance, a reasonable but problematic way of trying to cope, to try to maximize flourishing, thriving, coping, blah, blah.
What if society saw mental illness as a coping strategy for trauma, pain, and suffering, instead of something to be ashamed of? Would more people get help? Would more people feel comfortable inviting a friend to get help? Would less people die? If you or someone you know is struggling emotionally or are concerned for the mental health of yourself, a friend, a coworker, or a family member, there are ways to get help.